What we're going to be talking about today is the future of cleaning and shaping. And interestingly, the future really is now. Before we can move into the future, however, we do need to look back a little bit at the past. Dr. Herb Schilder, one of the foremost authorities in our field, many years ago said that the goals of cleaning and shaping were not only to remove all of the organic substrate from the canal system, which is what had previously been thought, but also the development of a purposeful form for reception of a dense root filling. And these are the two overall goals of what we're trying to do. But the objectives of cleaning and shaping are to create a continuously tapering funnel. That's the shape that we want to create inside the canal. He also guided us to tell us that the preparation should flow with the original shape of the canal. It shouldn't move the position of the canal space outside of where it was. And also that we should maintain the spatial relationship of the original apical foramen. In other words, after we have completed our instrumentation of the canal space, there should be no change in the position of the apical foramen. Unfortunately, that can happen, and the goal of what we're trying to do is to avoid that, to maintain that place. And finally, the apical opening should be kept as small as possible, and we want to preserve the natural anatomic constriction that exists at the cemento-dentinal junction. And by preserving this and keeping this apical opening as small as possible, we prevent having our filling materials be extruded beyond the end of the root. And so even though the apical opening is kept as small as possible directly inside the canal from that, it does need to be widened adequately to know that we have completely debrided the canal space.